My name is Melinda and welcome back to my channel. In today's video, I wanted to talk about treatment options available for high-functioning autistic spectrum disorder. I also wanted to break down the different factors to consider when deciding what type of treatment to use for your child. And at the end of the video, I'll let you know if I have a preference between the different type of methods, what I prefer, as well as letting you know what I did decide to use when having my two boys treated for their high-functioning autism spectrum disorder. If you're not already subscribed to this channel, please consider subscribing, and also make sure to share this video with people who you feel like might benefit from this type of content. When it comes to looking at treatment for high-functioning autism spectrum disorder, it really breaks down into two different paths, and that's either treating with medication or treating with some form of therapy. I often get asked in my practice, Melinda, is there a certain treatment that's better than the other? Should I do medication? Should I only do therapy? Should I do a combination of the two? And the answer that I always give is, do what you feel like is best for your child. At the end of the day, we as providers are here to offer recommendations and what we think your child would benefit from. But ultimately, you as a parent also have to feel comfortable with what you are giving to your child or what is being done to help your child. If you do not feel comfortable with your treatment, then you're not going to mimic it at home. And if you're not comfortable with it, then we're not going to get the progress that we need to have. So make sure first and foremost that you're comfortable with what is being recommended, and if not, let them know that and come up with another treatment plan. Another important thing to remember is that there is no cure for autism spectrum disorder. So you need to make sure you have a realistic expectation of what treatment can do. Whether you're using medication, therapy, or a combination of the two, the goal should be to improve how your child is functioning, that they're able to be more social, that they're able to make friends, and be able to better regulate emotions. You should never have the expectation that we're going to cure autism because there is no autism cure. Medication is one of the treatments for high-functioning autism spectrum disorder. It is often prescribed by a pediatrician or by a psychiatrist or psychiatric nurse practitioner as myself. When trying to decide what medication to best prescribe for your child, the provider typically does is look at the symptoms that are being presented and prescribing a medication to address those symptoms. For example, if you come in and say your child is having a lot of anxiety or having a lot of stress in situations, then more than likely they'll prescribe an anti-anxiety medication. Or if you say your child is very aggressive, hurting themselves, or having a lot of meltdowns, then the provider will probably prescribe something to help reduce all of this aggressiveness or reduce that the meltdowns that they're having. Again, the whole purpose of medication is to reduce the problematic symptoms so your child is better able to function and be able to make it throughout the day. That is why, as a parent, it is very imperative that you are able to make sure you let the provider know what things you're seeing or what things you feel like need to be addressed, so they're able to pick the correct medication for your child. Important to note, and this is something I really want to make a big point about because I see this all the time, and that is guilt in having to give our child medication. No parent wants to give their child a medication if they can help it. So if you've gotten to the point to where you feel like this is the best option for your child, then don't feel guilty about it. The same way you would give your child Tylenol if they had a fever, this is what you're doing when it comes to treating autism spectrum disorder. If you're seeing things and it's causing your child not to be able to function, they're having a harder time, and you just see they're just not doing well, but medication would benefit them, then don't feel bad for putting your child on medication. It's something to help them be able to make it better in their environment and be able to feel better about themselves and just be able to function in general. Another thing to note, and I might make a video about this later, is CBD use in autism spectrum disorder. It is a new thing that is being mentioned that CBD can be beneficial in helping reduce autism spectrum disorder behaviors. This is something that very few doctors are starting to get into, but some of them are seeing success by using CBD to help treat autism spectrum disorder. Currently, this is only being able to be prescribed by psychiatrists or neurologists because they're able to prescribe controlled substances at a higher level than a psychiatric nurse practitioner. But again, if this is something you want me to go more into depth about, let me know in the comments below and I can make a whole video just about CBD use in autism spectrum disorder. Another form of treatment for high-functioning autism spectrum disorder is using therapy. And the gold standard therapy recognized by the FDA is actually ABA therapy, which stands for Applied Behavioral Analysis, which is a scientific approach to understanding behavior. In ABA therapy, they like to look at ways of improving necessary skills like communication, language, or social skills, and also ways to reduce harmful skills, so things like self-harm or destruction of property. ABA is a wonderful tool that is used for treating autism spectrum disorder, and a lot of times people who use this type of treatment see huge gains in how their child does and performs socially, and also as far as making gains in different types of behaviors and things that they can achieve. However, if you do not have a formal autism spectrum disorder diagnosis, you will not be able to get your child into ABA therapy. This is the therapy that you have to have had your child diagnosed to be able to use. Without the diagnosis, I don't care if you want to pay cash, I don't care whatever the case is, you cannot use it. I don't understand. I wish there was another way. Trust me, I tried before my kids were diagnosed, but you have to have a formal autism spectrum disorder diagnosis that is done by a clinical psychologist or a developmental pediatrician for your child to be able to qualify for ABA therapy. The other therapies do not always have the same criteria diagnoses. A lot of times other therapies you can use without this one. So if it's something that you do want to try to help to use for your children, make sure you get the diagnosis, and again, make sure it is done by a clinical psychologist or a developmental pediatrician, because there is a very particular way they have to code for it to be recognized by insurance and for it to be accepted for them to qualify for ABA therapy. Other additional therapies that you can use to help treat high-functioning autism spectrum disorder are things like social skills groups or social skills therapy. This is a great one, again, in that in-between time while you're maybe waiting to have your child diagnosed, or even if they are also getting ABA therapy, because it hugely focuses on different social skills and making sure they can do better in social environments. Like we mentioned in my video last week, other great therapies to use whether your child is diagnosed or not also includes things like physical therapy, occupational therapy, musical therapy, equine therapy, and also just individual or family therapy. The whole purpose of any of these therapies that we're using for the autism spectrum disorder is working on ways to change behavior. So using different approaches to make it to where the child can learn to do better at positive behaviors and reduce negative behaviors. One last point that I'd like to make about therapy, a lot of times with the therapies, whether it's any of the therapies actually, ABA, occupational therapy, physical therapy, a lot of times they will assign homework and things that they want you to do as a parent at home. And this is extremely helpful because it allows you as a parent to learn some of the skills that they're using to help your child and be able to mirror them at home. And this is also good because if they can do the behavior in different settings, then you know that your child has learned the skill and they'll be able to continue to use it no matter where they go, whether it be at school, out with friends, or whatever the case is. So with those therapies, if they give you the homework, please make sure to do it with your child. It is very key, it is very imperative. There's a reason they're assigning you these things to help your child. If they're doing physical therapy and they're trying to help them learn how to bathe themselves, then don't go home and bathe them. Help them learn to use the skills they're learning. That way they're able to gain independence, and that'll help them later in life. All of this, again, is doing things to help your child to be able to be more on level with same-age peers and be able to be successful. That also helps them to not be so anxious. It also helps them to reduce some of the negative behaviors we see. When they feel good about themselves and like they can do things, then it does reduce a lot of those negative behaviors that we see. So you do want to make sure as a parent that if they give you things to try at home or tell you things that they're working on, even if they don't offer up homework, ask them, say, hey, what is something that I can do to continue this at home? That way you can make sure you're getting the best benefit out of therapy. So between the two modalities, which one do you pick? Which one do you choose? Again, it's a very personal choice. It is something that you have to decide what's best for your family, what's best for your child. When it came to my two children that had high-functioning autism spectrum disorder, I used a combination of the two. So I had my kids on medications to help address some of the needs that they had. Both of them suffer with severe anxiety. So one of them has social anxiety and one of them has just generalized anxiety about everything. So by having them on a medication to help treat their anxiety, it has been game-changing because their anxiety was so debilitating that they couldn't even function. So even learning some of the therapies and necessary techniques, they couldn't because they were too anxious about it or too worried in that situation to be able to learn anything. And so that's where I feel like medication was helpful for my kids. because without it, they wouldn't have been able to use any of the skills that were necessarily taught to them with therapy alone. But I also feel like therapy is also beneficial. Specifically, ABA therapy. It has been game changing. Oh my gosh, if you have an autistic child, get them an ABA, get them an ABA, get them an ABA. I see why they say it's the gold standard of treatment. And I feel like that mirrored approach of both has been huge because, again, we're able to use the medication to address certain behaviors we see, but as they learn things in therapy, as they learn different skills, as they got better at being able to talk and express and work through their emotions verbally or with us, as we're able to use different techniques like token systems, like visual schedules and things like that to help them work on, then we were able to eventually taper them off of certain medications, and now they very minimally use any medications at all to help treat. Well, that's all I have for this video here today. I hope you've enjoyed and gained a little bit of knowledge on both the type of treatments for autism spectrum disorder. And hopefully this will help you decide when you're looking at your child which modality you want to try. Maybe you want to try medication, maybe you want to try therapy, or a combination of the two. Again, thank you so much for watching. If you've enjoyed this video, please make sure to give it a thumbs up and make sure to come back next week. I put out new videos once a week on Sundays, and make sure to share with anybody else who you feel like might benefit from some type of video like this. If you have any additional questions about medication or different therapies, please comment those down below and I'll make sure to answer all those questions. And I'll see you guys next week. Bye.